You hesitated. Is hesitancy now a threat to global health? Vaccine hesitancy is now seen as one of the major threats to public health and is even labeled as a mental illness that needs to be cured. In January of this year, 2019, the World Health Organization, WHO, ranked vaccine hesitancy as one of the top 10 threats to global health in 2019. The World Health Organization is very concerned about the problem of vaccine hesitancy, which they say is threatening the effectiveness of the worldwide vaccination program. In short, some parents are not automatically allowing their babies to be vaccinated even though such services are available. They are pausing, thinking, and in many cases walking away with their babies in their arms and leaving the vaccine-filled hypodermic syringes to be used for someone else. Adults are also not responding to calls for receiving vaccines even when they are free. As always, WHO is on the quest for 100% compliance with all vaccine schedules and is warning the world that vaccine hesitancy is causing unnecessary illness and death. They believe that 1.5 million children die each year from causes that could be prevented by vaccines. Concerns about vaccine safety can be linked to vaccine hesitancy, but safety concerns are only one of many factors that may drive hesitancy. Vaccine hesitancy can be caused by other factors such as negative beliefs based on myths, e.g., that vaccination of women leads to infertility, misinformation, mistrust, and in the healthcare professional or healthcare system. The role of influential leaders, costs, geographic barriers, and concerns about vaccine safety. In this article from July 2010, Dr. Mercola says, I think you see the pattern. American children and those in other developed nations are basically being used as cash cow guinea pigs so that drug companies can smile all the way to the bank while they sell these vaccines later at reduced prices to countries that get the money to pay for them from the same countries whose children are being pushed in line to get them first. At this point, you probably don't even want to hear that in the US and Europe, drug companies are doubly rewarded with 6-month extensions on their patents when their products are targeted for children, or that additional subsidies in the form of grants pay for the research and development of these vaccines. But it's true on both counts. If it sounds like an unending round robin, it is, with drug companies winning the game in every hand. Knowing this, I'm sure that you, like me, have no doubts about whose children will be the guinea pigs for the HIV, AIDS, malaria, and other advanced market commitment vaccines. With AMCs, donors give vaccine makers a guaranteed market and price for their products. In return, drug makers promise to sell the vaccines at low-ball prices to poor countries. Will new technology make it easier for systems to force vaccines on you? Keeping track of vaccinations remains a major challenge in the developing world, and even in many developed countries. Paperwork gets lost and parents forget their child is up to date. Now a group of researchers have developed a novel way to address this problem, embedding the record directly into the skin via a tattoo. The research conducted by MIT bioengineers uses a patch of tiny needles called microneedles to provide an effective and painless vaccination. Microneedles are embedded in a Band-Aid-like device that is placed on the skin. A skilled nurse or technician is not required. Vaccines delivered with microneedles also may not need to be refrigerated, reducing both the cost and difficulty of delivery. The team uses a technology called quantum dots, tiny semiconducting crystals that reflect light. Along with the vaccine, a child would be injected with a bit of dye that is invisible to the naked eye, but easily seen with a special cell phone filter, combined with an app that shines near infrared light onto the skin. The dye would be expected to last up to 5 years. The work was funded by the Gates Foundation and came about because of a direct request from Bill Gates himself. The researchers hope to add more detailed information to the dots, such as the date of vaccination. Along with them, the team eventually wants to inject sensors that could also potentially be used to track aspects of health, such as insulin levels. Who knows what other information they will be able to put into the dots? Bank account, perhaps? So, you hesitated. Getting a clue, are you?